This is the new staff office training module for accounts receivable, insurance billing, and collections. Let's discuss some of the different insurance providers you may come across and what types of patients they cover. First, we have CHAMPA, or the Civilian Health and Medical Program of the Department of Veteran Affairs. CHAMPA covers specific healthcare costs for the dependents of a veteran who are disabled permanently as a result of injuries or conditions suffered during their time in service, and dependents of veterans who have died during service. Secondly, we have COBRA, or Consolidated Omnibus Reconciliation Act. This is a federal government law passed to provide a safety net for individuals recently terminated by an organization that provided healthcare coverage. The terminated employees and their families will continue to receive coverage from the previous employer's healthcare plan for a maximum of 18 months or 36 months if they are disabled. Next, we have Medicare, which is a federal program that provides healthcare coverage options to individuals who are over the age of 65 and some younger people with qualifying disabilities. The program is divided into different parts known as Part A, Part B, Part C, and Part D, and each provides insurance that covers specific pieces of healthcare for those eligible. Then there is Medicaid, also a federal health care coverage program that is for individuals considered to be low income. The cost of this program is covered by state and federal governments. There is also CHIP, or Children's Health Insurance Program, and CHIP provides health insurance to children whose families are unable to afford private health insurance, but whose income is also too high to qualify for Medicaid coverage. Next, we have TRICARE, which provides insurance to active service members and their families, retired military personnel and their families, and survivors of deceased service members. Finally, there is workers' compensation insurance, which is for employees who have suffered injuries or illness during performance of their regular work duties or on the job. Now let's talk coding basics real quick. There are three coding systems you will be using frequently, and they include CPT, ICD-9, and ICD-10. These coding systems allow for the diagnosis of a patient, any procedures performed, and services rendered to be transformed into numbers to represent the information to be used for billing purposes. Here is a better explanation of each of the types of codes. CPT stands for Current Procedural Technology. It is the standard for coding medical procedures and is used to identify services provided so that insurance companies can determine how much the physician should be paid. ICD stands for International Classification of Diseases, and it is a standard system used for recording diagnoses and clarifying mortality and morbidity statistics, meaning morbidity refers to your level of health and well-being, and mortality refers to your risk of death. ICD-9 is the ninth revision of the ICD coding system, and it connects health issues of patients by using 3 to 5-digit alphanumeric codes, while ICD-10 is the 10th revision and classifies the diagnosis and health issues of patients with 4 to 7-digit alphanumeric codes that stand for signs, symptoms, diseases, conditions, or injuries. It is important to keep in mind that commercial insurance providers are for-profit, meaning that their success depends on the premiums that are collected from insured businesses and individuals, and government insurance providers do not earn a profit from premiums. Now let's take our focus to the financial aspect of patient claims. You need to know the difference between copays, coinsurance, and deductibles. The copay is the fixed amount that a patient pays for a covered service, and our office requests copays to be paid at the time of service. For example, a patient may have a $40 copay for an office visit. We will inform the patient that their copay is due when they check in for their appointment. Next, there's coinsurance, and this is where the patient shares the cost of a covered service with their insurance provider, and it is usually calculated as a percent. For instance, a patient may have a 20% coinsurance, which means they pay for 20% of the cost of a covered service, and their insurance covers the other 80%. Finally, there is the deductible, which is the amount a patient owes for covered services before their insurance plan starts to pay. For this example, a patient may have a $2,000 deductible, which means a patient is responsible for paying for their covered services up to $2,000, and then their coverage kicks in and pays 100% until their coverage period is up. Our office utilizes the CMS 1500 form for medical claims and billing. So let's discuss the basic formality of the form so you are familiar with how to complete it. Box 1 is where you enter the type of insurance. Box 2 is for the patient's name. Box 3 is where you enter the patient's date of birth and check the box for male or female. Box 4 is for the insured's name, which is not required unless billing for an infant using a mother's ID. Box 5 is the patient's address. Box 6 is patient's relationship to insured. This is only going to be self or child. Box 7 is the insured's address. Box 8 is the patient's status. Box 9, letters A through D, is for other insured's information. Box 10, A through C, is patient's condition relation. Box 10D is reserved for local use. Box 11, A through B, is for insured's information also. Box 11C is used for Medicare crossover claims. You enter the Medicare carrier code. Box 11D is where you enter if there is another health benefit plan. Check yes or no. Box 12 is for signature and date. Box 13 is for insured's or authorized person's signature. Box 14 is for the date of the current illness, as in the first day of symptoms or date of injury, or for pregnancy, the date would be the last menstrual period. Box 15 is for if the patient has had the same or similar illness, you enter the first date of symptoms from the first time. Box 16 is for the dates the patient is unable to work. Box 17 is the name of the referring provider or source if applicable. Box 17A is if the ID number of the referring physician if applicable. Box 17B is for the NPI number of the referring physician if applicable. Box 18 is for any hospitalization dates for current services if applicable. Box 19 is reserved for local use, if applicable, for procedures that require additional information, justification, or an emergency certification statement. Box 20, if applicable, is for if outside labs were done. Box 21 is where you enter the diagnosis or nature of the illness or injury. Box 22 is not required but is for the Medicaid resubmission code. Box 23 is the prior authorization number, if applicable. Box 24A is for the dates of service. If services were provided only on one date, like an office visit, you only enter the date in the from column. Box 24B is for the place of service. In our case, since this is a medical office, the code would be 11. Box 24C is an emergency indicator. Box 24D is used for procedures, services, or supplies, and you will enter the applicable CPT or HCPCS code. Box E is for the diagnosis pointer. Box 24F is for charges. Box 24G is days or units. Again, since we are a doctor's office, it is going to be a 1 here because they only visit us once per appointment. Box 24H is the EPSDT family plan code. Box 24I is for the ID qualifier. Box 24J is used for the rendering provider's ID number or NPI. Box 25 is where you enter the federal tax ID number for the billing provider. Box 26 is the patient's account number. Box 27 is whether or not the provider accepts the assignment. Box 28 is the total charge. Box 29 is the amount paid by the other insurance provider. Do not enter Medicare payments here. Box 30 is the balance due. Box 31 is the signature of the physician. Box 32 is the service facility location information. This is where the provider's name goes. Box 32A is also service facility location information, but this is where you will enter the NPI of the facility. Box 32B is again service facility location information, and you enter the Medi-Cal provider number, if applicable, for an atypical service facility. Box 33A is the billing provider info and phone number and the billing provider's NPI. And finally, Box 33 is also billing provider info and phone number and the Medi-Cal provider number for the billing provider if it is an atypical provider. This is just an example of the CMS 1500 form that we just went over. You see all of the different areas that we discussed, what goes in what box, and this is what you will be using probably every day. You play an important role in this office. Our office counts on you to achieve the shortest collection time possible. You are responsible for, but not limited to, understanding legal concepts, contract negotiation, compliance, patient rights, patient access, charge capture, health information management, and patient financial services. Communication is key. No question is a stupid question, so don't be afraid to ask. Accuracy is a must. Please take your time and make sure things are done correctly and efficiently.